Good morning, everyone. Thank you so much for joining me. My name is Beth Reichert. I am the Director of Operations here at HireLevel, and if I've had the pleasure of talking with you before, it's good to see you. If this is our first time meeting, hello, and thank you for spending a little bit of time out of your day to hang out with me while I talk about something that really has become kind of near and dear to my heart in the different industries that I've helped support and grow over the many years here with HireLevels. So we're going to be talking about healthcare and HR and people management strategies and how to evaluate what you're currently doing to be more efficient, to spend less time doing things manually, and to give your employees an overall better experience too. So if you don't know me, of course, I oversee the operations here within our organization, but I love nothing more than to talk business with our partners and to make friends and figure out how we can really be of help. I'm really software driven, technical. I'm also the math and tax person of the family. So I would love to answer and chat with you after this. So feel free to reach out once we get through this. If you have any questions, you can pop that in the chat or we can connect one-on-one. All right. So without further ado, let's go ahead and get started. So as I mentioned, I've worked with we take care of a lot of payroll and HR and people management for partners in our communities. And it could be a small startup chiropractor's office or a dentist or a multi-facility institute. It's really all across the board. So I feel like we've really developed a niche in supporting these industries. And what's great is that we've really been able to evaluate how software is used in order to see better results. And in the world of AI, right? That's the buzzword of forever, I feel like. But in the world of AI, keeping the human in the work that we do, but then also using technology again to just get us caught up with the times, but then also help with our employees. Employees are craving more access to their information. They're craving simplicity. They love software. We've got a multi-generational workforce. And as this continues to evolve, the push for technology for your staff is going to be just more and more prevalent every day. So the challenges that we see in the healthcare world when it comes to people management and just business management, complex compliance, OSHA regulations, right? Just documentation of everything, people, personnel. Sometimes you get those staff members that are with you for 20 years, right? And they are loyal to your organization and they do a great job. And then it seems to be like the trend is that you also get a group of employees where they just are kind of funneling through the door. So I see it happen both ways, but with that, it's a little bit harder to keep up with the compliance aspect of that. But really certifications, making sure that if you have certified credentialed staff on your team, that you're not having to, chase your tail trying to make sure nothing's expired, licensure good. But then again, also if there is an OSHA occurrence that happens, that you're tracking that and reporting that correctly. So compliance is of course top of mind. Taxation really, there's different taxable fringe benefits for different facilities and what they do and how things are ran. So we see a lot of taxable fringe benefits, personal use of company vehicle, all sorts of group term life, third-party sick pay, all of those buzzwords, those hot items that feels like is pretty prevalent within the healthcare industries. And so we have to support a lot when it comes to that. And then if you have some that are, depending on what state you're in, if you're in Kentucky and you've got a lot of local taxes, right? Or if you have employees crossing the border from Kentucky to Illinois. I sit in Southern Illinois, so I of course relate a little bit more to that, but we do take care of payroll in about 48 states. So we're really well informed on the different jurisdiction rules and when taxation needs to occur and making sure that you have a tool to support that. Scheduling, if you have part-time staff, variable staff, and you're having to fill different positions depending on what type of clinic you are, scheduling can be a real challenge, and making sure you have a tool available that's going to be supporting that to where there's not phone calls and emails and a paper schedule that's, making sure that's streamlined. And then of course, time and payroll needs. So retaining and attracting top talent, as I mentioned, it always seems like in that healthcare industry, there's just this group of different positions that are always hard to maintain and retain. And I think that even goes to say for in the nursing industry. I have family that are in nursing. I'm the lucky one who chose to go into payroll and HR, but I know that it's a pretty competitive market when it comes to that. So you've got to be able to tout those benefits that you offer, stay competitive in those benefits offerings, and then, of course, give a great experience. Balancing compliance and costs. I know cost is so important, and a lot of people are wasting money using various tools instead of just streamlining it all into one product, but then also the time and the ROI when it comes to a lot of you are wearing that hat for everything, right? You are HR, you are payroll, you are doing your marketing. I see that in healthcare pretty often is that the role of the payroll person or the HR person, you've got a lot of hats, that's for sure. So, and keeping staff engaged and productive. There's always a little bit of hesitancy when I work and consult with partners in this industry because things have usually been kind of old school. Practices have been, oh, it works, so we don't need to change it. And I think some people get nervous about what change brings to a facility, but they're surprised when they do start instituting some of that change and how excited people get and how excited the staff can be. I'm not saying that there's not going to be that tenured employee that's like, nope, I'm not doing this. That's absolutely the case. So you've always got to have a little bit of a plan B, but you've got to keep staff engaged and productive. So why are healthcare leaders turning to HR tech? So the key drivers in this are to lower costs. Again, I mentioned using multiple platforms, multiple softwares, and then again, ROI. If you are in a position where you're doing a lot of things, you're going to get more time back in your day if you're streamlining things. And again, that will ultimately lower your costs. Better compliance and then stronger service. Here as of late, I'd say within the last year or two, we've seen for those of you that use QuickBooks for payroll internally, there's been a huge price increase in QuickBooks service, specifically QuickBooks Online. And there's not a lot of support in that for just talking about this stuff. Like, hey, this is a real challenge for me. We keep track of this via spreadsheet. And even when things happen like those taxable fringe benefits, not really have anybody to support that. And so we're seeing a lot of people who are trying to move away from QuickBooks because with a QuickBooks process, or if your accountant is using QuickBooks, your employees aren't getting the benefit of that. And then we're also seeing a big jump with some offshoring of customer service with some of these, we call them big box providers, and they're just not really getting the support. So that's where our team really likes to get involved, to sit and listen, to say, okay, let's talk people management strategies. How can we help really streamline that? So 62% are already using an HCM platform. And if you're a current client of ours or partner of ours and you're listening to this, there's a good chunk of this you probably haven't even considered. And while we don't like to be very pushy, we like to be very open to the conversation. I think sometimes it just takes just one conversation to pique interest in what else can I do? And 69% are right now considering switching due to some of those factors that I just mentioned. So capabilities for healthcare providers in our solution specifically, or just in a solution in general that you should be looking for, payroll-based journaling. So a lot of facilities are, you have employees that are jumping different positions. You may have somebody go from this clinic to this clinic, and you're needing to track that labor cost accordingly. So payroll-based journaling is really important in this world. Now, if you're a smaller practice, that may not be as important, but you're still using your QuickBooks and you're still doing some of that. So just because you're not using QuickBooks as your payroll solution, because you need a little bit more support when it comes to the uncomfortable hard stuff, you can still absolutely import your QuickBooks, your general ledger accounts and get that job costing, no problem. Easy in and out, clocking in and out, that has got to be easy for your staff. Nobody wants to have trouble when they're clocking in and out. And so that is imperative, and you want that to be built right into your payroll solution. Comprehensive OSHA tracking. That goes without saying, I think. Additional shift management, and here's a little screenshot just of our solution and what we do there for shift management. But swap boards, requesting time off, seeing that schedule ahead of time, letting employees even interact with each other to swap some of those shifts if they're eligible, right? If they have the same credentialing and work the same amount of hours, et cetera. there's a lot of capabilities in now the scheduling world than there was 10 years ago. So shift management's become pretty big. Automation of workflows, ACA reporting. If you have over 50 full-time equivalent employees, even if you're multiple EIN, you need to be mindful of that ACA reporting. I'm the guru here of the family for ACA, so if you have questions on that, definitely throw that at me as well. Attendance management and HR tracking certifications. Okay, so when we surveyed the healthcare industries that we work with, and iSolve, the solution that we use, surveyed, here's the top items in demand right now, ironically. So employee surveys, you having a survey sent out to be able to scale how the employees would like, what they would like to see, how do they feel about the people management process and all of that, or just even the culture alone, being able to gauge them. That's like the number one thing in demand right now in your world. Benefits enrollment, my favorite. Streamlining that process. If you are about to go through open enrollment, I feel you, I'm with you. We have so many partners who are. Some of them, it's just a click of a button and loading some new stuff into the software, and the other ones, man, they still have those paper packets and they're having to hunt people down to finish their enrollment. HR analytics, of course, being in competitive and pay raises across the industries and being able to review compensation packages, raise evaluations, all of that. Time and attendance, and a learning management system. So learning management system, a lot of people have their own solution, but if you have something that's can be built in, that's even better. I know there are certain states now, back to that compliance, that require, in the state of Illinois, if you have one singular employee now, you are mandated to be doing anti-harassment or sexual harassment training. New York, California, several of these other states require those items. But then in your industry specifically, there's a lot of different training that you're trying to do, OSHA specific training. So a learning management system is definitely key to making sure you can track who's completed that stuff and also communicate due dates and when those timelines need to be completed. Okay, so just breaking that down, employee surveys, almost half of HR healthcare leaders are looking for technology to automate the deployment of employee surveys, gathering insights to improve retention and automate feedback collection. Benefits enrollment, 67% of employees find enrollment stressful. I'm going to talk personal experience here. It was just a couple days ago. Now, mind you, I said I'm the payroll and HR guru of our family. My husband says, honey, it's open enrollment. Do you want me to just forward you this email with the packet on it? And I, of course, slow eye roll. I'm like, yes, okay, that's fine. But, and his is still a little bit of an outdated process with his company. And I can't even imagine what he would have to do if he didn't have somebody who this is what they would eat, sleep, and breathe every day to complete this. And for a lot of employees, when it comes to either tax forms like W-4s or I-9s, or even just an enrollment form, they don't know what they're doing. And they really don't know what a lot of these benefits that you're offering. So and I will go into this here shortly, but I really like to use the automation of benefits enrollment for an education standpoint, because it's a scary solution. It's a scary thing. HR analytics, we're trying to collect and make informed decision predicting workforce needs. When do you need to hire your next staff? When do I need to add a nurse on? When do I need to have more people in billing? Whatever that might be, using some of those data-driven analytics to be able to visually look at that and look at the performance. And then time and attendance, I think this is one of usually the buzz items, whether you're a small facility or a large facility. Time and attendance is definitely one that can tie people up, and tracking that. And again, tracking the different hours. If I'm going this morning, I'm at this clinic, but now I got to go over here to this one, tracking some of that. Definitely is something that's going to be beneficial and is big time talk for most HR leaders in the healthcare space. And then, of course, the learning management. 36% of employees say that they are missing access to a learning management system for training. So if you're doing lunch and learns regularly, if you are sending emails asking people to complete things, if you're able to let that be more independent, that is the best thing to do. And then it helps you track that. So we talk recruitment to retirement here when it comes to life cycle of an employee and what everyone is trying to do and how we're trying to just keep up, right? It can be very intimidating. How do you keep up with technology? And I always tell people, let it be modular. Start with your biggest pain point and then keep moving. Don't get stagnant. Keep progressing, because once employees usually get into something for a timekeeping or payroll or automated time off request, then they're usually more comfortable with then doing the benefits enrollment and the scheduling or certification renewals and things like that. So here's kind of how we group things together here at HireLevel: employ, enable, and empower, and the different things that fall within that. Of course, this is just a quick view of all the different items. I'm not going to be going over all of this today. This is going to be just more specific to what I usually see, what we usually consult with, and what we hear HR healthcare leaders wanting. Okay, so I'm going to go ahead and jump into our software here in just a moment to show some different things to try to get some brains power going, to get you guys inspired about making some positive change to health. But I did want to mention a couple things here. So we at HireLevel, if you have not heard, we just celebrated our 30th anniversary, which is incredibly exciting. And we are doing I've been here for a third of that, by the way. So for 10 years, I've been supporting partners like you. And in celebration, we are actually doing a big promotion for 6 months free payroll for new partners. So if you are not working with us and want to visit that conversation, and that is payroll and timekeeping, please reach out to me if you know of anyone that might be interested, or even if you're a current partner and there's some products on here that we talk about. We're definitely doing some promotions with that too. So come celebrate with us and let me know. All right. Without further ado, let's go ahead and get jumped into the software here. So where I like to start is always the beginning of a life cycle in this. So we talked about compliance and we talked about taxation. So sometimes turnover can be a real challenge in healthcare. And with that, if you are still collecting paper packets, or if you are using a separate software than your payroll solution to collect onboarding documentation, this is where you need to really evaluate streamlining that. So within the iSolve solution here, everything that you see, what's really great is very tailored. So here I am the employee and I'm going to be completing my onboarding. Let's zoom in just a little bit for everyone. I can do this from home. Now I can do this on my mobile app. I can do it on a computer. And if you have employees who are maybe a little tech challenged, they can do that in office with you. But really your goal should be for new hires to send this out ahead of time so that day one, when they come in, you don't have to sit there and they don't have to be intimidated by that I-9 and W-4. They're doing this ahead of time and it's a little bit easier. It's already going to feel good on day one, because we all know that first week is typically like drinking through a fire hose, right? And it's full of a lot of paperwork. So we're going to try to get rid of that. That is like top of the list, in my opinion, on things that a lot of businesses specific to healthcare are missing out on. So you can see just here, we've got a welcome to the team message. I always talk about with partners, make this engaging. If you have anything that's like commercially or a video from the CEO or a video from someone there, your website, add that into this process so they can see it and get excited and feel and care about your mission statement within your organization, because you want this to feel exciting and make it a good fit too for that retention standpoint. There's different forms that you can collect. Here you can do, actually, I'm going to toggle over to a different account that's got a little bit more so you can see visually. Of course, it's timed me out. It means I was talking too long. Bear with me. Okay. All right, so here, this one has quite a bit more in this. So there are forms that are actually a fillable form. So the direct deposit form, I'll just take a click at that so you all can see. So this is something that you would take your paper packet that everyone fills out, you translate it to a fillable PDF, and they'll be able to click into this and actually fill this information out. So this is our direct deposit authorization form. They'll fill that information out and then they'll be able to click save, and that actually stores electronically in their profile within the system. There's no more paper files. We're trying to get rid of that, right? That's your goal. So all of these different policies, we've made that a fillable form to where the employee is actually typing in their signature. And in addition to that, so you could either do that with your handbook and communicate handbook changes within the system too, or you can have them actually just sign and acknowledge it electronically. Instead of having to actually type in a name, you can absolutely do acknowledgement. This upholds in court. This is them signing off on it. It's date, it's time, date stamped and everything. So really nice starting off right off the gate. You get all those papers filled out, you get it all signed, and they're doing this from their phone, they're typing it. Again, we just took out probably a couple hours of someone's day just by doing this. So when they hit next, here's really, it's going to kind of be like a wizard format. So welcome documents we just looked at, but let's look at the personnel information. The employees can upload their profile picture, which gets everyone excited. Once they are onboarded, when they get into their mobile app and they see their little picture in the corner, it just feels more personal. It's like, oh, look, I've got access to all my information and there's me. So they can add that information in there. And then when they click About You, they'll be able to quickly put in their name and information, their demographics. And so this is a singular data entry point, right? This is where this just immediately then translates into benefits. It then translates into timekeeping and payroll and everything else. So the employee is doing the work of entering this into the system for you. You no longer really have to enter anything except eventually their pay and information in there. I mentioned some of that taxation. So this, once you put in the address and zip code, it knows exactly what tax jurisdiction needs to happen. And maybe you've got some students that are working for you part-time. If you're local in a university area, they can have an alternate address put in there for their W-2 to be mailed off to. Contacts, we're going to collect beneficiaries and dependents. That's for emergency contact purposes, but also for benefits. That way, our carriers know exactly who to cover. Am I going to cover, if I'm asking family coverage, then I'm going to put in my dependents that would allow me to elect something like family coverage. Same with beneficiaries. If I am automating open enrollment through here and I'm electing for life insurance, I can put my beneficiaries and that's going to go straight to the carrier. So that way that communication happens through the system. I'm going to hop around just a little bit. So paycheck, this is where they add their direct deposit. You can see there's no message on this, but you can absolutely add messages to the sides of the screens, which says things like, in order to have direct deposit, you must also attach a voided check within your supporting documents. So you can definitely put that there. And then you can also go into here in taxes. This is one of my favorite parts because I've been in the payroll world a long time. And when you go to open Tax Wizard, it's going to start asking you to fill out your W-4 electronically. I can't tell you how many times our team takes calls from angry employees or partners and clients of ours who have employees coming to them upset because they owe when they file their taxes in January. If you're listening to that, raise your hand if it's ever happened to you. I've got both hands up. But I think the nice thing about doing an automated W-4 is that, especially for this one, is that it asks the questions in a way that feels more just simple. And it feels like I'm not having to be responsible for filling this out so much. I'm just going to show you here in Marion and click save. It needs my address in order to allow me to do taxes. So I need to add my social security number here. It's too smart. It's so smart. So that's the nice thing. I'm going to put in a date of birth. Okay. And so I'm saying what's mandatory to collect and what's not mandatory to collect as well. And when I go back to my taxes, it should let me do it now because my social's in there. So this is what it looks like when you're filling out your W-4. And now it knows federal or Illinois based off of my address. I come in here and it will ask me what I need to do and break that down. And I'm going to just say standard federal withholding. I'm not qualified for the foreign earned income exclusion. You can also do this in English or in Spanish. They are currently working on other languages as well. And there's also the option to do this entire thing in Spanish if it was needed. So I'm going to go ahead and hit start. Are you a non-resident alien? And then here's a description on this. No. Was I exempt? And I am not exempt. And so here is, it tells you, right? We know most of the time no one is exempt from withholding. And then it's asking me my marital status. just do single. Asking me if I want to use the estimator for the most accurate withholding. Do I want to use the multiple job worksheets or none of the above? For the sake of time, we'll do none of the above. Do I want to claim dependents? Yes. How many dependents? We're going to say 2 and 0. I don't want to collect the next step. And so then it's populated my W-4 down here. I'll be able to preview it. And what's nice is you saw me enter 2 dependents in there and then automatically put $4,000 because I can't tell you how many times people that fill this thing out wrong and they meant something else. So it's going to take that and very simply translate it onto the forms. And then this is going to save electronically. Remember, W-4s have to be kept on file, I believe, for 3 years. And so with that, they'll be able to always have that. If there is an issue when they're filed their taxes, you can go back and look at it later. EEO, vets, and disability. If you are just depending on your size, you should be reporting that, collecting that. With I-9, this also will create electronically. So when I click on Form 99, it will prompt me to fill everything out. That is then going to translate onto that form. I will sign off on it with the last 4 in my social. And then once my onboarding process is completed, as the employer, I'll be able to go in, fill out my portion within the system and use the I-9 audit tool to ensure that I've completed all of my I-9. So again, back to that compliance piece. And certain states require E-Verify. Alabama, I know Tennessee is over a certain amount, North Carolina over a certain amount. So you may need to do E-Verify if you're of that size of an employer, but otherwise you just probably need to just collect that I-9. So additional information, this is where we put what we call miscellaneous fields. And so at HireLevel, we like to celebrate any chance we get. So we collect celebration treats. You may want to collect t-shirts. Maybe you have uniforms or scrubs, something like that that you give out, and you may want to collect those different shirt sizes. You can either make this a fillable or have a drop-down shirt size and collect that, and then you can run a report off of it. So anytime we get new t-shirts here at HireLevel, our marketing team can go in and quickly run a t-shirt report, send that off, and then they don't have to track everybody's sizes down. So that's really this onboarding here. Now, everything you see on the left, there could add more. So we mentioned certifications. So if you wanted to collect credentialing from some of your staff, and you can have different templates. So say you have a billing template and you have a nurse template and you need to collect credentialing and have that scanned in the process. You can have different requirements and different templates based off of your different roles. So you can absolutely change the settings here, put more information in here, really make it tailored to what you need. So once they're onboarding as the employee, we're going to switch over to an active test employee here. And let's take a look at this one. So this is what an employee's dashboard is going to look like. Now, some of you are probably reluctant to give access via mobile app, and I hear that a lot, but you at least want them to be able to do time off requests and payroll related things like viewing their check stubs, downloading their W-2s, all of that from home. But this is exactly what it looks like on the mobile app or as it looks like on the computer. So it's going to give me a little dashboard. So it will tell me my course assignments. If I have my integrated course learning management plans, it will tell me my different time off requests that are outstanding for me because I am in a manager role as this test employee. And then over here on the right, I get my quick little synopsis of my time off availability. And then I can request time quick from here. And I see my menu items here on the left. Now, I have timekeeping enabled here, so let's talk about how easy this is to punch in and out. I log in, I simply click punch, quick punch, punch again, and I am done. I'm clocked in for the day. So this is going to tell them whether or not they're in or out. So if there's confusion, if they got distracted, coworker was talking to them, something happened, they'll be able to know. Now, if I were in an instance where maybe I came in and there was a patient in the waiting room and I got distracted right away, and I forgot to clock in, instead of having to track them down, employees are going to be able to submit their missing punch. So they'll just click on that clock radial, come in here and say 10:31. This is what happens. Maybe they needed to clock in and out to a specific department. They'd be able to get that if that was set up here and clock in and out there. But I'm just going to hit save. And so that's going to submit a missing punch to my manager or supervisor. They'll be notified, and then they'll be able to approve that from the dashboard so my time card looks correct. All right, so that's punching. Let's pretend like I'm the employee. I need to request time off. I'm just going to click on this little button here, and it takes me to the screenshot, the little synopsis of all of my time off requests: birthday, emergency, floating holiday, etc. I can break down and see that detail if I'd like. Close that. And if I scroll down, I can see upcoming time off, holidays, pending requests, etc. So, but I just need to ask off. I'm tired. I don't want to work on Friday. I'm going to come in here and I'm going to choose on my policy, and I'm going to select PTO. It tells me what I have available right then and there. And I'm going to ask, I can put in the time. It will we also can set rules to default time. Let's just say I need the day off. So when I click save, there's going to be some built-in workflow where it's going to either send to, you may have several, you may have just different people involved in that process that need to know. So maybe it's going to route to one place first and to another place after that, or maybe it's just one person that's going to approve it. They'll get an email notification when a time off request is approved or needs to be approved. And then the employee will also get the email when it has been approved or rejected. Additionally, there can even be reminders when that upcoming time off is coming. So that way a manager and supervisor doesn't necessarily, oh yeah, that's right, Beth's off on Friday, I forgot, right? Or that's coming up. So it's a nice, especially for me, we have several different offices and team kind of scattered throughout. So it's nice to know and be reminded of who's off when. I can also go to my dashboard here. I'm actually not going to, I want to go to my calendar here. So as a manager and supervisor, this is where I can also come and see, this is specific to my schedule. So if I had scheduling in here, I would see that. I can go to my team calendar. And so that will navigate me to the traditional experience. The team calendar isn't officially out in the mobile app yet. It is still on the traditional view, but you can set up team calendars. Let me show you the calendar as a manager and supervisor though. So it auto defaults to just this current month, but if I wanted to come in and drill down, I can absolutely click on this. I like to view things by the week. So here I can see the different time off requests that I have, what's pending and what's being approved. So as a manager supervisor, I can definitely come and look at this for the week. If I had scheduling enabled in here, I would also be able to come in here and see the schedule for my staff. So it would look a little bit different because it would see a true schedule in a different color and all coded that way. So you could see and actually look at it from there, and even from the day, who do I have off, who's working what shifts, etc. So this is much easier for managers and supervisors to prove. And as I mentioned, for the employee experience this month, they will be adding the team calendar in here, but employees, if you want them to, can also see who's going to be on the shifts with you, or they can only see their shift. You can absolutely lock that down. Okay, so let's take a look at expenses. That's not necessarily something that gets in too much. No, I don't see too many healthcare industries needing expenses, but sometimes there are expenses involved. So if you have people asking for reimbursements and things like that, you can absolutely track expenses through payroll system, through this system, because and even code those to your accounting, to your general ledger. So very easy to do as the employee. I can come over here and do upload or details. I type in that information. I can attach my receipt. If I'm using my mobile app, I can just take a picture of that receipt and it's going to autofill all of this out for me. And then it will then again go to my manager and supervisor or the payroll HR department for approval. And then last but not least, the other piece I wanted to be sure and review from an employee engagement perspective is the benefits. So if you are if you're not automating open enrollment, you've got open enrollment coming up, please let me know. I'm happy to talk talk about strategies and even with your broker as well to help educate and encourage employees to really review the benefits you're offering, because that is really part of their compensation package. So here I can come into my open enrollment. I'm also going to get notified when things need to be done. So I've got 17 days left to complete my open enrollment. I can click continue. It showed the benefit handbook on that last screen. So when I hit continue, over here on the right, I see my shopping cart. So per pay, how much is going to be deducted from me. I can update my beneficiaries and dependents. On this health and wellness tab, a lot of plans have tobacco affidavits and or wellness affidavits. You can turn that on so it will calculate the premium correctly for your payroll deduction. And from an employee, again, I want to do this at home with my significant other, or as the employee, if I'm a single individual, I want to have this to be a little bit more visual so I can see the pros and cons of everything. So I'm at home currently completing this, and I can see my current benefits, what I've enrolled in, what my cost is. You can actually even enable the employer cost so they can see how much you as a business owner is paying for them. And then from a cost analysis here, I can actually click on the different plans to see what it would cost me. So for medical pre-tax, this test company offers 2 different plans, and you would be able to see, okay, for the HDHP Gold, it's covered up until the family, but for the PPO Silver, here are my different rates and premiums. So they'll be able to truly see that. One really exciting piece that's coming out here this month that I'm just can't wait to show everyone is we talk about AI and how that helps. So there's some AI functionality coming to this soon, in that it will be connected with your provider. So let's say you use Blue Cross Blue Shield. The employees will be able to see how much of their deductible they use year over year. So if they're trying to decide between an HDHP and a PPO Silver, it's going to show that deductible usage. And in addition to that, it's going to ask them some questions like, do you have any major procedures planned? Is your child going to be getting braces? What kind of financial implications might you have? So it's a very personal survey that is only available to them. And it's kept completely data secure, but it's going to then suggest what plans they enroll in. So very, very cool stuff coming out there, and that it's going to make the benefit process even more simple. So, with something like FSA dependent care, I talk about this often when I do benefit webinars, and that a lot of staff don't even understand what some of these things are. So, and it may be a little different in the healthcare world. I would have thought the same for the payroll industry, that my team and colleagues would understand these things. And they still weren't enrolling in this until I was finally like, listen, do you pay for daycare? Let's talk about the advantages of these pre-tax benefits. What does that even mean for you? So we like to use some of these messaging on the right to talk about what is dependent care FSA, right? It's reducing your taxable income. It's saving your money on your taxes. It's ultimately just a reimbursement to you. And this could give you an annual cost savings, could be up to $1,500, right? Most employees just see that as a deduction coming out of their check, and they get scared and they don't know what to do, and they don't, because a lot of people live paycheck to paycheck, not realizing that something like an FSA dependent care or even an FSA medical, those things are all just straight reimbursements. It's money you're going to spend anyway. So we like to use this from an educational standpoint, and then also try to increase your enrollments. So they'll have to go through all of this, they'll submit it, and then you as the admin will have a dashboard to where you can quickly monitor who's doing it, who's not doing it. And then there will be automated reminders in the system that will harass them basically to get this stuff done. And again, if you have staff that maybe aren't tech savvy, have a hard time with this, you can absolutely walk through this with them. And basically, and even if you have, let's say, physicians that aren't going to do this, but you know what they enroll in, you can force select those different elections. So what's nice is, again, it's going to automatically send to the carrier. So there's not going to be a gap in coverage. All of that information is going to be taken care of. And if you also need COBRA support, you're required by law to send out COBRA notices, of course, upon termination of an eligible employee and eligible plans. There can be COBRA notices sent out with the termination in the workflow. All right, so I've spent quite a bit of time here. Now, there's still a lot that I could go over, but this is really specific to you. So let's go back and take a look at our admin side of things, because that's what most of you care about, I think, on this call, is going to be just really, well, how does this impact me? How am I managing this? What should I be doing? What does this look like? Is it easy for me? Of course, the employee side, yeah, it looks great. But what about everything else? What about me? How am I going to track these OSHA certifications and everything? So let me get logged in here. Okay. So here's what the back end traditional side of iSolve looks like. Now I see quite a bit more menu items, just because this is, of course, I'm a service bureau and I have a lot more access. So I'm in my demo account here, and I want to take a look at certifications. because that is a big one that most people ask about. So certifications here over on the left, I'm going to look at my client management certifications. So OSHA first aid, again, licensures, educations, that sort of thing. So CPR, RN, LPN, CNA, all of those different things. You can add those in as something that we need to add. Now, the employees can also manage this. I just always tend to spend time from the admin point of view. So I can quickly search this menu, or I can just click through it, but for sake of time, I'm just searching. So here I can go and I can see who all has certifications that are about to expire, what's coming up, what are the different dates. So this is a quick dashboard here under employee admin tools. Yes, I can see anniversaries and birthdays, but then I can also see my certifications. So if I needed to come in here and take a look, I can filter by expiration date. So I need to look at, let's say I want to see we'll pretend this is October of this year. I'll be able to filter off and see who's got certifications that are about to expire. Now, there will be a workflow within here that's going to let those employees know, and the manager supervisors, but this way there's another added layer to help you support and double check to make sure everything's taken care of. So where do we add that? So up here underneath employee management, and then there's human resources. This is where you track and add all sorts of good stuff. So under training and development, certifications, let's just go into Mr. Cameron Bailey here, and I'm going to hit add new. And we're going to say we've got our CPR certification. So we'll put in the effective date, the expiration date, put in your ID number, all of that good stuff in here, and it's going to save to their profile. And then again, it's going to go to that other screen that I just showed you that you'll be able to take advantage of. You'll also be able to track company assets. So if you do have equipment loaned out, whether that be a computer, door code, a key, cell phone, whatever that might be, upon termination, you'll be able to quickly run reports. And then as an organization, if you need to update computers or do some different things like that, you'll be able to run company asset reports. Okay, the other item I get asked about in your industry pretty often is OSHA incidents. So underneath our regulatory, so this is under employee management, still human resources, we're in the regulatory. So that's where you get your federal reporting data, your WOTC certification, if you are hiring individuals that allow you to take that kind of tax credit. But here's our OSHA incident. So let's say I need to add an OSHA incident underneath Cameron Bailey. Something happened and you are required to report that. You can see I hit add new. It automatically fills that portion of the information. That is when you'll be able to fill in the case information here, the incident details, the treatment information, and the completion information. So you'll be able to get this report and send it over to report to the OSHA website there, and they'll be able to take care of it. So this can all be tracked very, very easily. If you're having to manually do OSHA incidents, you don't have to. Okay, so this is just a quick look at some of the different HR pieces within the system. So when I talk about integrated training, because that is definitely one that's a buzzword right now in our world. So you can add different training in here manually if you need to. Maybe it's something outside of the system. Maybe they're going on site somewhere to complete a training, but you can also have that to where you're using the training that's already built within the system. So let me go ahead and get that pulled up. Give me just a second here, and I will show you some available training for your industry as it loads. Okay, I'm already logged in on a different browser here, but I could very quickly click on the iSolved University, and it's going to take me to my learning management system, in which case I'll be able to go to my classroom, and I'll be able to see that on my dashboard what courses are assigned to me. But let's say I just want to see what OSHA courses are available that I can provide. So I can click on courses here and just search for OSHA, and it will pop that up if I chose my right browser here. Let me see which one I'm on. I did the wrong one, I believe. Okay, I believe this is the one I need. Yeah. All right, and let's do cybersecurity. Now, well, hang on, guys. Sorry, I'm having some technical problems. Maybe it's logged into my demo account. It is logged into my demo account. All right, for sake of time, I won't get logged out and logged back into that other one, but you can see several pre-built courses that are within this, and this is related to different benefit plans, but they'll be able to click and you'll be able to assign different things in here. So, and as an employee, I'll be able to quickly see what I have assigned to me, and as an administrator, you can put that on there. So when I go to my courses, here's all of the different things that I have been assigned, that I've passed, or that are availability to me. So these are course specific. We assign internally, we assign the IRS publications for everyone to read. So you can see that in my past, have I not completed it? And then on my dashboard, I'll be able to see if I have any assignments that I need to complete. And in this case, on this demo account, I have several that are overdue that I need to complete. So you'll be able to track all of that, and then it's going to automatically translate over back into that training tab that I had showed previously. So really nice built-in functionality. When it comes to reporting, we're going to take a look at our reports here. And so there's already 300 pre-built reports in here, which is really nice. So you'll be able to quickly be able to look at different labor reports, general ledger reports. When I talked about OSHA earlier, here's my different OSHA incidents that I need to maybe pull to send my 300 days right there. You can create organization charts, overtime reports, etc. So there's already a ton of pre-built ones in there. And then there's also a report writer tool that's in this as well. Here I can quickly see on my analytics hub, how many employees, terminations, and hires have I had, gross pay most recent, and my different analytics and related to ethnicity, generations, and gender. So from an executive reporting standpoint, if you're having to go to a board or if you're just trying to review this stuff, you absolutely can see that by coming in here, and it gives you a quick snapshot. All right, so I hit several of the big bucket items. Not everything that we're definitely capable. I didn't go over the recruiting tool with applicant tracking system, where that's posting to over 400 job boards and integrating that to your website. But there's just so much. And I think, again, you can really get a shiny ball with this. What all can I do? The number one thing that I hear people talk about is usually time off requests, timekeeping in general, and scheduling. Followed quickly by the paper tracking of just different things, whether that be the I-9s and W-4s or open enrollment. So having just a pen and paper process that the employees don't love. Employees having really great access to their information to be able to update their W-4s, update direct deposits, make new enrollments. If I get married or have a baby, going through my life events to trigger enrollment eligibility, all of those things are probably the top items, followed quickly by some HR automation with things like certification tracking, asset tracking, OSHA incidents, etc. And then, they're just more. But those are the top three really priority, and that I've spent some time going over today. If anyone has any questions, I would definitely love to hear them. Let's see if I've got anything. I don't think there's been anything yet. Checking some different areas. Nope, no questions submitted yet. So that's really all I have for you all today that I've gone over. Again, if you have questions, please let me know. Here is my contact information. You can scan the QR code. You can send me an email. You can absolutely give me a call. I am more than happy to talk in depth and to really just be strategic about how this would impact your facility specifically. Please don't hesitate to reach out. I'd love to meet you and or have a conversation. So if you are joining this today and you're interested in participating in any of these things or evaluating it, please reach out and we'll talk about those different incentives and different offerings that we have involved. Okay. All right, everyone, have a wonderful Thursday, and we'll talk soon. Thank you much.